All right. I'm really looking forward to this episode, and thank you so much for taking the time to do this, Lisa.
Yeah, I'm happy to be here.
The last episode right before this, I talked to Manira Houdani and we covered like diastasis, like just helping people understand it because it's scary right now. I think there's a lot of messaging around it, which leaves people feeling really nervous. And so I wanted that episode to kind of shed some light on why is it normal and expected to experience diastasis during pregnancy, what kinds of things to start with postpartum early on, how it can be so beneficial to address it with rehab. But then we also came to the conclusion at the end that rehab is not enough for many people. And that's definitely something that I've been going through. I actually, I was always no, I would not. I've had limitations. I had a massive DRA I noticed during pregnancy, especially my second, really struggled after. That'd be the biggest thing I've been working on. But I was always like, I can do a lot and I don't have the money or the resources. But lately, I think I've been fairly open that I think it was turning 40 that all of a sudden I thought, you know what, this is all of a sudden like my life before me. And this is something that I really want to do. And so I know that you've been very open about your experience and the struggles that you've had, the pros and the cons. And so I really appreciate you taking the time because I think that you not only have taught me a lot, but I think that your experience is helpful for others to hear about too.
Oh, I'm so glad to hear that.
Yeah. And before we were filming, we talked a little bit about how this is such a tough thing to, like, how do you even, when people ask me right now, like, how are you doing or how are you feeling? I don't even know how to answer that in one sentence. And I'm sure that you can kind of say the same year. Are you over a year post-op now?
I'm almost 2 now.
Almost 2.
Yeah,
Wow.
I know. That's crazy.
And so I kind of wanted to start a little bit about, talking a little bit about just how you came to terms and maybe just talking about what was your journey like in the very, talk about your journey just briefly. Like, how did you come to this decision?
Yeah. It's also overwhelming, right?
Yes.
So, after my first, I had a really traumatic road of trying to figure out this diastasis that I had, understanding what it was, going through a bunch of stuff, being really fearful, being confused, people telling me I couldn't do CrossFit. I mean, all of it. Right. And then, got some better information before my second kid, but I went into that knowing that I had a pretty severe diastasis, severe in the fact that my tissues, like my hand would just sink down into my body. Like the tissue was really, really thin. And knowing that surgery might be on the horizon, right, when I was done with kids. So I had my second pregnancy and I controlled everything that I could. I still worked out and everything, but, I tried to manage my pressure and do the things that I could, but also knowing and feeling that kid was just growing right into that area. It was not going to get better. Had another big baby. And so it was always in the back of my mind, but I knew I had a lot of rehab to do and it's going to take time and I'm not going to rush into it. And I still don't know for sure if I'm going to get it. And so, So I go through my whole rehab, which was so much better the second time, went through all this stuff and then decided, okay, yeah, like surgery is probably going to be for me. And there were a few reasons too, to be exact. Even though I did feel very strong and I could do, I really felt like I had almost no limitations in what I wanted to do at the gym. I knew that if I got the surgery, I probably would feel a little bit better in a few of those things, right? But I was happy. I felt like I could do what I wanted for the most part. But I knew that those tissues that were very, very thin and my belly was severely protruding at rest when I wasn't in an active position at the gym, when I could really close my rectus to almost a 1. Like I could close it so well and it was so wide at rest. But walking around all day, that's not what it was at. Right. And my belly was really sensitive and it was very sensitive. And, if the kids kicked my belly it was just, as you can imagine, right, with the tissues there and organs and things like that. So I'm like, okay, getting older, I don't want to worry about getting a hernia or getting I mean, as you get older, tissues already are suffering, even if you're loading them and being strong and doing the things that can help with that. Age is still a factor. So that was the first reason. The second reason is I didn't want to look like that. I mean, I looked pregnant. I mean, some people say they look pregnant, you know what I mean? And I know it's all relative, and it's just like, well, maybe your stomach just doesn't look the same as it did pre-kids, which nobody's really does to an extent, right? But mine was very, very extreme. And so I didn't want to live like that. And I think it's important to say that, because what happens with the surgery a lot is I feel that women are ashamed that they want to get the surgery, whether they want to look different or for whatever reason, right? And then they go to blaming their DRA, right? Oh, well, I need the surgery because of my DRA, and I have this back pain because of my DRA, and I need the surgery. And they get really, 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 they throw everything into that. And that can be harmful for two reasons. One, what everybody else is seeing, and then everyone's terrified of diastasis. And two, the self-fulfilling prophecy of being in pain and needing the surgery. And there's so much that you can do if you have the care of a really good physio, a really good PT that can help you through all of that stuff. And it gets really dangerous when people are looking to this surgery to solve a back pain, a prolapse, incontinence, all of these things that get wrapped into, just give me the surgery, and then these problems are going to be fixed. And it really doesn't work like that. It's like, yes, some people do experience some success in feeling better after the surgery, which is great. Others don't. And we could get into the intricacies of that, right? There's many different reasons for that. But again, I think this surgery is the messiest thing right now that is out there. And that's why I'm just so passionate about talking about it.
Yeah. And I agree. I really struggled with, I had a pros and cons list forever. And my cons list was always longer than my pros list. Like the same things that you just said. I was scared, obviously, for the risks associated with surgery. The cost was a huge barrier. So I know that like every surgeon's slightly different. Every surgery is slightly different. Every country is going to be different,
but it's all expensive.
The quote that I was given was around $12,000 plus 6 weeks off work and the time to stay in an Airbnb, like a lot of different things. And so that was a huge con. And a lot of guilt wrapped up in, we could go to Disneyland like a few times for that. And mom's taking that money to do cosmetic surgery. Do you know what I mean? Like, I know that it's not only that, but like do you know what I mean? And so, and just the logistics of having two young kids and needing the help. And it was a lot that put in the cons list, but then, I also was noticing that I had plateaued with my exercise. I think I might've been a little bit more limited in that I'm lucky. I'm an exercise dabbler. I do a little bit of everything. So I find that I can get away with, if something's bothering me, I'll just swim a little bit more than run, or I'll just, who cares if of course I'm not lifting more. I only lift once a week. So I wouldn't, do you know what I mean? And so sometimes I think I made excuses, but I definitely babied my body. And as I mentioned, I think it was turning 40 and same things as you, is like, wow, long-term, what is this going to look like? Because I found the same things, like discomfort after eating and like almost like not back pain, but back fatigue after eating. So I think that I was just trying so hard. I, like you, could compensate well. I can cheat well, but I was finding that it was almost the day-to-day stuff, like when I wasn't really focusing on it, that was bothering me. And I kind of think of, when you just now you mentioned, there's a lot more to it than just fixing it. And it's not that different than some of the orthopedic surgeries. And this is something that my surgeon and I talked about. He said, you don't have to do this, Mel, but he said, think about an ACL that needs to be repaired. You don't have to repair your ACL. You can get by with strengthening. And he said, but you're going to start to notice that you're going to take the elevator instead of the stairs. Or when your family's out skiing, they're going to do the blue runs and the black runs, and you're going to stick to the green runs. And that's what I was noticing. I baby myself. And I think that that's important to acknowledge, that if you had an ACL tear, you could go through the surgery, but if you don't work up, like with everything else around the area, the hip, the knee, the ankle, if you don't build your strength and you don't do the recovery, the rehab after, you still are going to have some benefits, but I don't know that you'd get back to the function that you're looking for.
Sure.
Right.
Yeah.
And so you're right. There's so many things to unpackage. And I think that it's really important to acknowledge that we've both had, I'm sure, hesitancy with sharing our story. And I have really been hesitant because I don't want my message to make it sound like everybody needs this or that you need this for success. Because as Munira and I talked about, diastasis falls along a spectrum. And yes, we all are going to experience some degree of it during pregnancy, but not everybody is limited after. And even if you are, there's a lot that you can do without. And I think that it's an important time to just say, like, this is just our story. And I think that I can speak for myself and maybe you too. And just that if anything that I share is helpful to people, I don't mean to put an impression on anyone though, that this is something that needs to be done. So I'm not sure how do you approach that?
Yeah, it's so hard. It is so hard. It's so hard. Yeah, it's just so messy. It just is, because it's wrapped in with an idea of the aesthetic. It's wrapped into the mom guilt, like you said, spending the money, going under surgery willingly for something you need, right? It all gets in your head. It's all of these things. And it's just not something to take lightly because of that, but it's also not something we want to necessarily demonize either, because then what happens is nobody really talks about it. And then that perpetuates all this confusion and shame and all that other stuff too. But we also don't want women like acting like it's no big deal. And some of the plastic surgeons do make it out like it's no big deal, I think. And then they message me after and they're really upset about how recovery is going. But one of my surgeon friends that I interviewed on my IGTV, who I talk to now, she was saying, because I spent so long trying to do everything that I could do to strengthen my core, right? And do as much as I could with this diastasis. I went through a period where I was really, really afraid for 18 months. And, but I was progressing still because I was working
like
with
18 months postpartum.
18 months postpartum after my second, I was progressing, but I was still being very guarded because I was kind of traumatized what happened before. And then around 18 months is when I did that consult with Anthony Lowe. And he was like, no, you're at the perfect time. We got, and he ripped off the Band-Aid and had me just move again. And I felt amazing. I felt better. Actually, my diastasis got a little bit better. Like the tissue didn't change, but a lot of stuff around it did. Because I just was doing high level gymnastics moves and I was doing on the GHD and all these things that you're not supposed to do. And I did them and I felt great. And I got better and better and better and stronger and stronger. So,
and just to interrupt you for a second, Munira and I talked about that yesterday, is that's how our body gets stronger. You have to push it a bit, and it's not just about the gap. It's about all the muscles around there. So I'm sure that's what you were doing, is almost like you were babying it. You start pushing it. And all of a sudden the whole system's like, hey, I can do more than you were letting me. So go ahead.
Yeah. And, anyway, what this plastic surgeon was saying, she's like, but Lisa, not everybody's like you. Not everyone's going to want to do that. Right. And so I have to understand that too. Like, not everybody is like me. Not everyone's going to want to go through all that. Right. And if they don't want to get back to those, if that's not what they do for fitness, they don't want to get back to that. I still am very passionate about making sure those women do strengthening core stuff somehow. Right. Work with someone to get as strong as possible and then see, do I still want the surgery or not? Either way is fine, whether it's the way you look or if you don't feel strong, fine. But at least try. But at the same time, not everyone's going to be going into surgery as strong as I was, right? And that's also okay, given whatever spectrum people are on with that. But the difference is, and so I understood what she was saying, but the difference is I don't want women going into this surgery from a place of desperation. Mm-hmm. That is the difference. Like, you are choosing it. You're nervous, you're this, but you're not desperate. Right. And it's like, it is something I see time and time again. And that's when people either rush and maybe choose a surgeon that maybe wasn't the best fit, or don't have all the information going into it. Just don't feel empowered at all. Like, and that is what it is. I don't expect everyone to be doing muscle ups with their diastasis if they don't want to, or if, people that, are runners, right. Right. So no, they're not going to be doing that stuff, and they don't want to do that stuff. But are those people making the decision from a place of knowledge, education, empowerment that they want the surgery, then great. Then you make your decision. I don't feel like there's enough of that information out there.
Mm-hmm.
And then there's a black hole of recovery, right? So, postpartum isn't that great, but it's getting a little bit better. There's stuff there. This surgery, it's like zero. There is zero. Like, so women are just thrown to the wolves. Like, your whole anatomy has changed. Your stomach is numb. Your core is life. Getting up off the couch, we're using our core, but they say don't use your core for X amount of weeks after this surgery. It's awful.
That's what I want to interrupt you and tell you, like, I wrote down one of the things that you said on your website. Prehab and rehab is something that rarely happens with this surgery. If you think it's rare to get good postpartum care, post tummy tuck care is basically non-existent. So you have to be ready to fight for it. And I think that, like, just to tie in exactly what you're saying is that, when you have a really significant diastasis, your whole body's affected. Like I always say, it's almost like moved on to a different way of moving. It's not necessarily an efficient way of moving sometimes, but then you change that. The surgery changes that. Yeah. And I think that's why so many women come in after. They're like, I look better, but wow, Mel, I'm leaking now. Or I think prolapse started after, or my core is weaker. Yeah. And so I think that's what you're just about to talk about, but maybe speak to that, because I think that's the reality. Like you said, you're going in thinking like the surgery will fix it. But I think a lot of women find like, whoa, I didn't know there was all these other things to consider.
Yeah, it is. It's so hard because, pelvic floor symptoms, because you're so tight, right, from the surgery, and you're so tense and you can't, it took me so long to be able to relax my belly again. At one time I was like, am I ever going to be able to relax my stomach? Like, I was so frustrated. And so there's a lot of tension. I had some weird pelvic floor stuff go on for a few weeks. I didn't freak out because I knew why. Because I normally don't have any pelvic floor issues. And it was because I was overly tense, and I knew that that's what it was. And so that was okay. But, you just, sometimes women feel really disconnected from their cores when they have diastasis, right? Everything's different. You're not sure. And maybe you get some help and you feel connected again, ideally as connected as you can feel. Maybe you don't, but whatever camp you're in after this surgery, that's the most disconnected I've ever felt. And I went through so much rehab, and then I trained myself to train other women, and, and so going into the surgery, I was as connected as I could be and played around, used myself as a test case for this huge diastasis, doing all these things people thought were crazy. Right. So I did all. And after this surgery, I was just like, oh my gosh, I don't even know where my stomach is. Right. And then I kind of started back at basic number one with my PT and, all of that. And actually the reconnecting went really well because I'd done it before. Exactly. And so I knew it was really cool. Like, I knew I couldn't quite fill everything. I couldn't connect it, but I knew what it felt like. And I just kind of kept working on it. And it was really, really, really cool, but it was really hard for me. So take that to someone that maybe hasn't had all that help and this team of people around them and all of this stuff. And then thinking, oh my gosh, what have I done? Right? Like, this is so hard. And not everybody though. Some people, and I do want to say, some people have easy recoveries from the surgery. It's all over the spectrum.
I'm sure.
And so I don't want to make it out like, I had a really hard recovery. So there are factors that we cannot control. Like, I'm healthy, whatever, other people are healthy. Like, it doesn't, not all of that really matters in the fact that how you're going to feel pain and recovery and all these things. Right. So it's, so there are people, but then, there are people that had it worse than me, and there are people that had it easier than me, and all in between.
Exactly. But I think that one of the things that you pointed out, so we've talked about how kind of you came to terms with, okay, this is for me. Yeah. And, me too. I have my surgery actually in like 2.5 weeks. And so everything that you say is definitely sticking in my head. But one of the things I also noticed on your website, and I'm going to read it word for word, overall, I cannot stress enough that the right surgeon for the job is absolutely the most important part of the process. Don't let price or other things let you, choose against the better fit. And so I think that's a big thing for people to navigate. And I wonder if you could speak to that a little bit, is choosing a surgeon.
Yeah. Oh God, it's so hard. So there's a couple issues. The first one is if you are an athletic person, it's hard to find a plastic surgeon that understands what you want to do. And you feel like you need to be understood in order to trust somebody. But that doesn't necessarily mean they're not a really good surgeon if they don't understand. So that's really tricky. So where do you draw that line, right? Because you still want a really good surgeon. Then they all do the surgery a little bit differently, different sutures, different techniques, and all these things. So then that drives you crazy. So really what it boils down to is finding a surgeon that you trust, which is really can be difficult. For me, it was really hard to trust anybody after everything I'd been through. I find some people are too trusting. Like they just like go to one and they just do it. They no other consults. Because the tricky thing about the surgeon thing is that you don't know what you don't know. Like you have to go in like as a data, like put on your detective hat and go get a bunch of consults, take your list of questions, download on my website. You know, if people don't know where to start, it's not all the questions. It's still got my bias in there, right?
But like, I looked at that before we did this discussion, and I think you've done a great job of just helping women arm themselves with questions, knowing what to ask. And I thought you did a really good job of saying like, advocate for yourself, especially when you're spending this much money. Ask your questions. And if you need to write them down. But yeah, because I think otherwise you go and you just assume that you will have all your questions answered, but then you leave and you're like, wait a minute, I don't know what this looks like.
And you just get nervous in there, right? And so then there's the tricky part of, well, good surgeons sometimes don't have good bedside manner. So then you have to distinguish between, you know, is it worth it? Is it not? Like it's really, 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 really difficult when it comes to all of that stuff. And that's why I think you just need to see a lot of them, because then when you kind of know, you know, and that's why that price point, this guy's $1,000 cheaper, $2,000, this is your body, right? And so this surgery is already ridiculously expensive, right? We put it on a credit card. We just paid it off. So that was exciting, you know? So, but you know, like if you're going to spend the money, if you're able to spend the money on the surgery, don't let a couple $1,000s deter you on surgeons. Because I have talked to people who've regretted who they picked for whatever reason, or they had a complication, and complications can happen with really good surgeons too. Of course, it's surgery. However, right. It does make a difference. So there's the trust, there's getting a bunch of consults so you even know what you're looking for. So you can see a difference. They're all going to have different opinions, and it'll give you more ideas of more questions to answer. You do want someone that you can actually communicate with. That's the biggest thing. You need to be able to ask questions after you go home and think about them. What's their post-op care? Like, because post-op is very confusing and overwhelming, and you're going to need check-ins and am I okay? And right? And so you have to look and see what that's going to look like. You know, if they'll see you extra times, or how often do you go in post-op? What options are there? And you need to feel like you are really taken care of, and that the surgeon's working with you, like with you, not like
on you.
You know, they're just some God that's gonna, you know, nope, I know everything. You know what I mean? Like, and I know surgeons can have that attitude, but I know the ones that I interviewed and the ones that I really like are very, very good surgeons, and they're not like that. I mean, they're confident, which you want them to be confident. You want them to be good at what they do.
Totally.
Right. It has to be that way, because it's a big deal. And, it's a big surgery.
Where do you find, I think that's the nice thing about, I always say, I feel blessed that I have the job I have, because I have some insider knowledge. But what would you say, like for people that don't work in the industry or whatever, where would they even start? Would they start with like a recommendation if they're seeing like a PT or like a physical therapist, they could ask their PT, right? Any other, like, where else would they start?
Yeah, I know, it's so hard. So actually what's interesting is I have this little surgeon network now of women surgeons, because not my surgeon was a male, but the two other surgeons I interviewed who I really like, I think they have a network of like, women surgeons that they're a part of. Right. And that they trust. And so sometimes I can find people like, hey, where are you at? Oh, try that. And then I'll message. It's pretty cool. So maybe I need to like get, just like GFAM is with Tracy Shares group. Maybe I need like a plastic surgeon group, like like we trust that are
Yes.
like in the know and
Yes.
promoting PT and all of that stuff. But I find PTs like, so Nancy Boyd, my friend in PT, and now we do a bunch of stuff together, but you know, she had never worked on someone right out of the gate from the surgery. She'd worked on people that had issues maybe a year later that came to her, but she's an amazing PT. Now she did great. And, you know, we did great together and she just took care of me and it was fun for us, you know, but, and so PTs don't necessarily know. Now she worked at University of Michigan, so she kind of knew some of the surgeons there. But it's hard because you can get recommendations from people, you know, you can kind of start there and start that way.
But it's so individual, right? Like everybody's coming to their own individual. And
it's so weird.
Yeah. And I would say I agree as a PT. And this is part of the reason why I chose not to have my surgery in my community. And I always kind of stumble on this because I by no means say that they're not good surgeons.
Okay.
But as a PT, I have never had a referral for prehab or rehab. And I've checked with other pelvic health PTs in town and same thing, which made me think, oh, okay, maybe that's not being considered. And I want that to be considered as far as technique and post-op care, like you said.
Yeah.
And so I ended up, I'm traveling 4 hours to see someone that is well connected with therapists and is always working back and forth with them.
Yeah.
And I found that this is funny though, because I only saw one person. I didn't interview other people because I felt like again, I'm not saying that's bad advice that you say at all. I think it's great advice. Maybe that is a little bit of inside information that I had, but I just knew enough to know that this person is someone that sees a lot of back and forth. The bedside manner was amazing. And every time I went, I felt more confident. I have his cell phone number to text with any questions before and after. And so I felt really supported. And I think maybe at the end of the day, like if you go to meet someone and if it, for whatever reason, it doesn't sit right, don't be afraid to go to another one. Cause you're right. Like it is your body. And I wonder then, like, can you speak to then, I would love to cover the negative stigma because I've definitely had, that's something that I battled with. And I never want to say that someone else should feel bad about having the surgery for looks or for aesthetic reasons. I just never thought my name would be in the same sentence as plastic surgery. I didn't. Yeah. And so I sometimes feel ashamed when I admit that I'm having this surgery for a lot of the reasons we mentioned, but also because I'm someone that definitely preaches for rehab. Not that it's the be all and end all, but I've had to battle with this myself. And I wonder for you, I mean, you've mentioned that as you've started talking about it, you're having a lot more people reach out. Yeah. Yeah. And I think people really grapple with that.
Yeah, it's really hard. I think it's hard. I just think, I think I cried the first time I was even sitting in the plastic surgery place, you know, when they called it a cosmetic procedure. It's just, you know what I mean? Yes. Like it was just, even though it was 100% partly cosmetic, I don't want to look like that, you know, the rest of my life. Although I did, you know, I talk a lot about loving my stomach, but not liking the way it looks. Mm-hmm. Cause I really did. I was strong. I was happy. It helped so many people. Like it just changed everything. And so I think that's really cool. You know, again, my hope for other people is to get to that point where they feel confident enough with that they are confident, yet they're like, well, I don't like this and I'm going to change it. Right. Mm-hmm. Like there's a difference again from that versus being so desperately disgusted with yourself, mm-hmm. which is where many moms are. Yeah. The only reason I got out of that myself is because I felt strong as shit. Mm-hmm. Like, and I was like, all right, like that is what that's what changed everything. Right. Mm-hmm. And again, you know, is everyone going to feel that way? No. Right. But again, I think that having the knowledge, because let's say it is just an aesthetic thing for you, for somebody, mm-hmm. right? That it's 100%. There's no other considerations like you and I were talking about with our mm-hmm. situations. That's also okay. But my concern for those women is, do they really know how hard recovery is going to be and all the things that go with the surgery? Making sure that they're informed and knowing that that decision is one that they're choosing to do fully informed. Because I feel many people are not fully informed from their surgeons.
Well, and you've talked before about how like, it's not going to take away your stretch marks. Like,
yes,
like some of that, it depends. Like, what are you unhappy with and what are you looking for? Because that's something else you should clarify is like, what are you wanting out of it? And make sure that you understand like what this surgery looks like and what you will have after.
Yeah. I just made my tip Tuesday this past week about, not looking perfect. So, there's different things, right? So the stretch marks, some people, they can pull all the way down. If you don't have any high stretch marks, then maybe you have none after, but most people just have them lower, right? Because the skin's pulled down. Then you've got that issue. Then you've got the belly button. So it's going to look different. It's not going to look like it did pre-kids. It's not going to look like it does right now. So it's no different. Does it look like you had a tummy tuck? Does it look natural? Does it, right? I mean, it's different. It's not better or worse. And some women are not really happy with that. And that's a whole issue. Then you've got this large scar, which you knew was coming. You saw the pictures, but then once it's on your body, you've got to deal with that. And then you've got the swelling and bloating and all these things where people forget that, like, okay, I'm a human that eats, and like, my stomach's not going to be flat at 6 p.m. at night after I've eaten all day and drank. Even if you're eating healthy foods, like, you're still a human. And they're upset they don't look like a Barbie doll because they've had the tummy tuck. So again, it's going into it, understanding what the surgery really is about. Brianna Battles always says, like, it's not better or worse. It's just different. And it's true. Like, there's some things that you might be like, this looks great, I'm stoked. And other things you're like, oh, this is kind of different and hard to deal with. So you're going to have to get to loving and accepting yourself, tummy tuck belly, just like you hopefully tried to do after having the baby. But I think what the problem is right now, when it comes to, like you were saying, the shame of the surgery and how messy it is this body positivity thing. Just like anything, we have to look somewhere in the middle of it all. So yes, we want to have body positivity and be proud of what our bodies did and brought these kids into the world. And this is all amazing, right? And be grateful for our body and realize it to be this amazing force that it is, no matter what it looks like. But on the other hand, it's also okay to be sad that it's changed so much. And so in the middle of it, it's because then there's shame around women. So then, first of all, you feel like you failed because you don't look good after you have a kid. Then you feel like you failed because you're not accepting yourself and you're not accepting your body. So then you just feel like the biggest piece of shit. Totally. And it's the biggest mess, right?
Totally. And it's funny how that's one of the things I said in my cons list. I said, I know as a healthcare provider that I've done everything I can, and there's only so much that I can do. But on the outside, I said, especially to people that don't understand, I was worried that they'd say like, well, I don't want to go see her if she can't fix herself. Then why would I trust her? And and I also talked openly about, I have a daughter and I've always been really proud. Like my kids are always saying, Mom, do you have a baby in there? Or my kids even, I remember one time when my daughter was young, she's like, did someone shoot you in the tummy, Mom? Like they always are commenting like it's jiggly. And I've always been really proud of my reaction is always like, you guys stretched me out, and Mom's tummy will always be like that. That's a reminder that you guys were in my tummy. And now I'm changing it. And so I feel like I've made sure that, my messaging is like, you know what, Mommy's doing this to be stronger. And, because I do feel that's another piece of like guilt or a shame that I feel is that I have a daughter and that, I want her to be very positive, but yet I'm changing my body. And, so again, I think it's all in the messaging. And at the end of the day, it matters what you want. I feel very, I'm excited as I get closer. I'm excited. I'm curious to know, I want to kind of shift gears a little bit. We've talked about mental preparation, but I think the logistics of planning for everything. And you've talked a lot, and I've really valued you talking about how important rest is. And I would say when people ask me, are you ready? I'm like, you know what? I feel like I'm crazy busy right now trying to plan to rest.
Yeah.
So it's like, I need to make sure, like, it's usually mom's the planner in the family.
Yeah.
My husband's a very supportive guy, but I still am the one that's kind of like, hey, make this for dinner, or
mental load. Yeah,
totally. And so I think that, just things like making sure that your kids are well taken care of. And I think you mentioned it's almost like 2 weeks that you made sure that you didn't have to be on mom duty.
Yeah.
That's hard for people, right?
It's so hard. And I know not everyone cannot be out of the house, but I stayed at my parents' house. They live close.
Yeah.
And no kids, no nothing. I mean, I can't turn it off as moms. And a couple of the surgeons I interviewed said one mom was at home, didn't think about it, got up because her kid was about to jump off something, even though someone else was in the room, and then her scar opened and she had to go back in. You know what I mean? Just because it's not full rest. Even if you're upstairs, you can hear, you know what I mean? It's just like, it's not, I mean, it is just, like, I think guys can, sometimes, turn that off, but mom brain, it doesn't work like that when it comes to the kids. So I stayed away for 2 weeks. And then the next week that I was home, I had a full-time person, same person there, doing most of the physical stuff. And I would sit around or maybe unload the dishwasher as my workout for the day or something like that. But like really just tried to, and then even the 4th week, my mother-in-law came a couple of the days. I mean, I really, really, really eased back into it. And that is opposite of my personality. Totally. I want to be Miss Independent Woman, like, it is just so important. And just all those stories, and all the surgeons say the same thing about actually resting, and especially the first 2 weeks. And then it gets tempting weeks 3 and 4, because you're finally maybe feeling a little bit better. And feeling like frustrated that you can't be you. Right.
Totally.
And that's when some temptation goes in to overdo it and all of that. And so just having the support lined up ahead of time. And then if you don't need it, you don't need it.
Exactly.
Right?
I even strategically picked my time because I thought, like, here up in Canada, like we ski every weekend. And I was like, if I do it in the winter and it's gray where I live in the winter, I was like, I think I'm going to be depressed. Like if my family's skiing and I'm sitting there, I think mentally I'm really going to struggle. And I said, I also don't want to be out for the summer. I don't want to miss camping. I feel like that will be depressing. But I don't want to miss Easter with my family. So I strategically chose like Friday after Easter type of thing, because I can see, and like, just it's hard to uproot your family or change everything that's going on. And I'm curious to know, Lisa, did you have any special equipment after?
Well, I got not everybody gets that recliner chair, the one that like automatically, lifts you up. I definitely got it. The way I am is like, I need to feel prepared. If I don't need it, I don't need it. Right. But I got it. I liked having it because it sits you up. You don't have to worry about figuring out how to get, you know what I mean? I slept in that thing for 2 weeks. And I loved it. Other people feel like they didn't need it. But that was pretty much it, was that. I'm trying to think if I had anything else besides that chair. I had bought a bunch of food ahead of time. I had made some stuff, that my parents could just warm up for me. Like you said, it's just a lot of overwhelming prep. I had lists for the kids, like what they had, this and that, and for the sitter and for my husband, and, like what vitamins like a document, a staple document. I mean, It's just a lot. Yeah.
Totally. And I think that you, like, again, you have gone through in awesome detail on your website, like what women can do to, like, considerations for preparation. And like I said, finding a surgeon. And then the other thing that I found really helpful, just to give me an idea, because I think I had an idea, but it was nice to see. And again, everyone's experience is very different, right. But I liked how you wrote out like recovery expectations, or just a timeline idea. And if you haven't checked it out, I highly suggest. I'll link obviously her website in the show notes, but it goes through kind of things to expect weeks 1 and 2, like, rest, getting up a few times a day, more just for blood flow, being upright, but spending a lot of time lying down, goes through like then weeks 3 and 4, weeks 5 and 6, and, or 5 to 8. But just, I thought that was really helpful. And I think that maybe if this is something that you're thinking about, have a look at that just to get an idea of like, what does that look like in my life? Because I know a lot of people consider this as soon as I'm done nursing, they say, but that's still, your kids are still pretty young. And I think that, lots of consideration. So just be able to picture, like, does that fit into my life? What time of the year would that fit into my life the best? How does that look for my job, my partner's job? And it is a lot, it's a lot to think about. And I'm not saying that we should be saying no because we are an inconvenience, but I think it's just all things to think about that affect the mental health after.
Yeah, it is. It's so, sometimes again, I do think the surgeons downplay the recovery. Not all of them, but some of them do. And people are just thrown for a loop. It's just, yeah, exactly.
So I really want to, well, first of all, thank you, because we've touched on some really important things, and I will link all the important information in the show notes, but I want you to just really briefly talk again. I talked with Manira last episode about an upcoming resource that you guys have planned. Will you talk about it a bit?
Yeah. Oh my gosh. This is just like so exciting.
Yes.
Every time we work on it, we're just like, So, once I kind of mentally and physically have recovered from the surgery, which was a long process, right? And I could kind of think outside of myself, I realized there is a huge, and actually during the process too, because even the help I was getting with Nancy and stuff, I'm like, how do people do this without support? Right. Huge gap in healing, in this healing process, huge gap in research. I mean, I asked my surgeon, head of plastic surgery at University of Michigan, like, hey, we're doing this thing. Do you have any articles about return to fitness? He's like, no, there's nothing. He's like, I'm so excited you guys are working on this project. I will help you, promote this when it's done and all this stuff. Right. So there's not much there. Return to fitness after a cosmetic, in quotes, procedure. Right. So that's missing. Also, the 6 weeks leading up to clearance, or 12 weeks or whatever, all surgeons do this differently, but they say, just don't do anything. Well, okay, we're human, so we're doing things, right? So what strategies can we provide to help you get up off the toilet and sleep more comfortably, and, do those types of things? There's a lot. What you can start breathing, you can do some breathing. Like, there's a ton you can do before you're allowed to do anything that can help. Right. And so our goal with this project is, Munira and I are working on a lot of the very rehabby stuff up through 6 to 12 weeks. And then I'm going to come in and create this kind of like, okay, we're getting back to deadlifting. We're getting back to these types of things. This is how we're going to do it. And, some of that stuff's similar to DRA stuff, but some of it's not. I mean, it's different. Right. And so we're hoping that this is kind of like a basic timeline that people can follow. That will be more accessible than working with someone one-to-one, which is also really great. And I love working with people one-to-one, but this can reach more people where they can hopefully get some guidance, where they just feel less confused, less overwhelmed, more empowered, feeling supported with a plan, as in especially that beginning area that is so overwhelming when it comes to recovery.
And scary, and I think this goes right back to what you said. Like, if you thought postpartum care or guidance was hard to find. And I think when you talk about this, I'm like, sure, sounds a lot like postpartum. I mean, there's a lot you can be doing in that first 6 weeks. That's not overloading the system, but it's more like just functioning in your day easier and with confidence. And knowing how to trust your body and knowing how to push your body safely as you move past the healing phase. And exactly, but it is different. Like, you're moving muscles and changing, and you're dealing with a lot of pain and, like you said, swelling. And so I think that there's a lot to consider, because you're right. I think that it is quick to be, after 6 weeks, you're good to resume activity. But just like with postpartum, like, that looks different for everybody. And you would never, after after you broke your leg or after you had your ACL reconstruction, you wouldn't rest it and then start back at a half marathon, or you wouldn't start lifting the heaviest weights. You know what I mean? Like it's, you know, and so I think that when you think about it, you're like, well, of course, but what do I do? Right.
What do you do? And they'll say, slowly get back to it. What does that mean?
What does that mean? Can I exercise?
What does that mean?
Yeah.
And what does that mean to different people?
Yes.
You know, you got a competitive CrossFitter, you got a runner, you got someone that does yoga positions. What does that mean for that person?
Yeah, like, exactly.
They all need some guidance, right? Yeah. In progressing, like it's, and then you're going to have, you know, those, you got these nerve pains that can, different people. I had that really bad, but everybody's really different. And there's just a lot of considerations that.
And you guys are hoping to have this out. Is it fall of this year, 2021?
Our goal is fall. Yeah. Yeah. So,
that'll be great. And I am more than happy to spread this in any way I can for you guys. I think that we've covered, I mean, I could talk about this forever, and it would be nice to touch base with you afterwards, because I would love your guidance there. Lisa, is there anything else that we didn't cover that you feel is important to touch on?
I don't think so. I got excited and talked a lot, I think.
No, this is exactly what I was hoping for. I think that just for other people to be, you know, just picturing that they're in this conversation and hearing the back and forth. Because again, we are just two people with slightly similar stories, but slightly different stories, different goals, different objectives. And this is just our journey. And again, I can't say it enough that this is not me saying you should have it or you shouldn't. This is just, I'm happy to share if it helps you feel more supported and gives you some guidance, but you got to do you, right? And
I think that's the biggest thing too, is just, I want everyone to know that it's okay to be somewhere in the middle of, you know, this whole body positivity and, you know, like, but I do want to look different. And then there's guilt about all of it. And I think we really need to support each other to figure out, to get enough support and enough information for you to feel like you make the decision that's right for you. And, you know, it's still going to be overwhelming and scary if you decide surgery, right? Because it's surgery is, but really feeling like people are making the choice to have a tummy tuck from a very empowered and educated place. Like that is my dream with our program, and just over the next couple of years, trying to get that information out there.
Awesome. I'm going to stop.